Welcome to ETMCTV and this informative presentation by Helen Cassel, Certified Nurse Practitioner at the ETMC Movement Disorder Center at ETMC Tyler, where she is also a patient. Cassel will discuss the use of deep brain stimulation for treating the symptoms of Parkinson's disease, essential tremor, and other movement disorders. Thank you for choosing ETMCTV.
If you can imagine being so tremulous that you can't stand in a buffet line holding a plate because all the food will fall on the floor, or holding a cup of coffee and it's spilling for somebody with essential tremor, and not wanting to go out to eat, they become very reclusive, and then not being able to do buttons up, not being able to put on their clothes properly, women not being able to put on their makeup, and then having DBS, and then the programming process we promise 80% control of the tremor.
DBS stands for Deep Brain Stimulation, a surgical procedure used to treat the debilitating symptoms of Parkinson's disease, essential tremor, dystonia, and other neurological movement disorders. The DBS system consists of three components: the lead, the extension, and the neurostimulator. The lead is implanted in the brain, and the extension connects it to the neurostimulator, a battery-powered transmitter that is implanted under the skin near the collarbone. The neurostimulator is programmed to send electrical impulses to the brain, which block the brain's electrical signals that cause the symptoms of movement disorders. One of Cassel's primary responsibilities at ETMC is to program the neurostimulators after they have been implanted.
So I see 5 patients a day for programming. It takes an hour at least for each patient, whether they be Parkinson's, dystonia, or tremor. And for people who come for their first programming, we allow 2 hours, deciding on their care, management of their disease, medications, adjusting the programming as appropriate, ordering more tests as needed, or physical therapy, occupational therapy, speech therapy, whether it's home health or at a facility. So there's quite a lot involved. And for people with Parkinson's, it helps tremor, helps rigidity, stiffness. It makes a huge difference to somebody's life, and I can attest to that. I had Parkinson's. I didn't know at first, but eventually in 2008 I started medication, and then 2009 the tremor started, and got on more and more medication. It would make me sleepy. It would run out. Night times my feet would be so uncomfortable I couldn't get to sleep, and life was pretty tough at that time because I was still working full time. And then July 2010 I had the surgery, had DBS and the placement of the leads. And it was, I can remember thinking, I wonder what it feels like to be on the other side, because I'd stood beside over 200 people when they'd had the surgery. And the drilling of the holes to put the lead in, and how does it feel when it's stimulated? Well, I found out pretty quick. It's good. It's good when that lead is stimulated in the OR. The tremor shuts down, the rigidity goes away. I would not be working. I believe I'd actually be in a wheelchair now if I had not had the surgery. I just can't imagine how miserable life would be without DBS. Talk with other people who have had it, and when we give out the DVDs for people who are planning on the surgery, there's a list in there of people who have had DBS here in Tyler, and they can call anybody on that list or email them and find out what their experience is. We also have a DBS interest group which meets 4 times a year, and people who are planning on having the surgery are invited to that, and they can meet with people and find out more.
Helen Cassel, RN, NPC, is a nurse practitioner at the ETMC Movement Disorder Center, where she is also a patient. The center is part of the ETMC Neurological Institute, located at 700 Olympic Plaza in Tyler. For information, please call 1-800-728-2702. To learn more about movement disorders, watch the ETMCTV program featuring neurologist Dr. George Plotkin on Suddenlink Channel 997. For more information about deep brain stimulation surgery, watch the ETMCTV program with neurosurgeon Dr. Mark Renfro, also on Suddenlink Channel 997.